Case 20 Progressive Multifocal Leukoencephalopathy, PML. Findings. FLAIR images show several large areas of hyperintense signal in the white matter of the right cerebral hemisphere and in the splenium of the corpus callosum. Small sites of cortical involvement are present. There is little mass effect. There is no abnormal enhancement. Differential diagnosis. HIV encephalitis. Other viral encephalitis, e.g., cytomegalovirus, acute disseminated encephalomyelitis, ADEM, non-announcing forms of toxoplasmosis or lymphoma, rare. Case 21 Polymicrogyria. Findings. Sagittal T1 weighted images show an area of small, irregular gyri and a serrated appearance to the gray-white junction, arrows, in the perisylvian cortex. Axial T1 and T2 weighted images confirm the abnormal small and irregular gyri. However, there is no signal abnormality in the morphologically abnormal cortex. Differential diagnosis. Focal cortical dysplasia. Pachygyria. Schizencephaly. Teaching point. Case 22 Hemimegalencephaly. Findings. The right cerebral hemisphere is enlarged. The right lateral ventricle is slightly larger and abnormally shaped. In the white matter of the right cerebral hemisphere there is hyperintense signal on T1 weighted images and hypointense signal on T2 weighted images for age. It is both focal, arrowheads, and diffuse, with blurring of gray-white differentiation. The cortex of the right hemisphere is dysplastic, thick, and polymicrogyric, arrows. Differential diagnosis. Gliomatosis cerebri. Hemiatrophy of one hemisphere, such as in Rasmussen encephalitis. Tuberous sclerosis, TS. Case 23 Vein of Galen aneurysmal malformation, VGAM. Findings. Sagittal T1 weighted and axial T2 weighted images show a large flow void along the expected locations of the internal cerebral veins and vein of Galen. These aneurysmal veins are continuous with the median vein of the prosencephalon, arrow, and there is no visible straight sinus. Sagittal MIP reconstruction from MR angiography shows flow-related enhancement in enlarged arteries and in the aneurysmal vein, consistent with the presence of a high-flow fistula. There is no hydrocephalus. Differential diagnosis. Vein of Galen aneurysmal dilatation. Case 24 Langerhans cell histiocytosis. Findings. CORT images demonstrate a destructive lesion of the left temporal bone with well-defined bone margins and an associated enhancing soft tissue mass. The left mastoid air cells are opacified. MR images demonstrate a heterogeneous enhancing mass, mostly hyperintense on T2 weighted images, within and superficial to the left temporal bone. Differential diagnosis. Coalescent mastoiditis with extension of infection. Rhabdomyosarcoma. Metastases from neuroblastoma or leukemia. Dermoids or epidermoids. Teaching. Case 25 Choroid plexus carcinoma, CPC. Findings. MRI shows a large, heterogeneously enhancing mass with lobulated margins, centered within the atrium of the right lateral ventricle. There is focal T1 hyperintensity within the tumor, black arrow, likely representing intratumoral hemorrhage. There is a fluid level within the lateral ventricle due to dependent hemorrhage, white arrows. There is T2 hyperintensity and enhancement possibly within the cerebral parenchyma along the tumor margins consistent with parenchymal invasion. Differential diagnosis. Choroid plexus papilloma. Atypical teratoid rhabdoid tumor. Ependymoma. Subependymal giant cell astrocytoma. Central neurocytoma. Metastasis. Case 26 Septo-optic dysplasia, SOD. Findings. T2 weighted MRI images show abnormally small size of the bilateral optic nerves and the optic chiasm, arrows. The septum pellucidum is absent. Differential diagnosis. Isolated optic nerve hypoplasia. Holoprosencephaly. Damage to septum pellucidum in long-standing severe hydrocephalus. Teaching. Case 27 Transfalcine, uncal, and transtentorial herniation. Findings. CORT after evacuation of the hematoma shows extensive hypoattenuation in the right hemisphere with loss of the gray-white differentiation. There is hemorrhage in the right temporal lobe. The leftward midline shift displaces the medial right frontal and parietal lobes under the falx cerebri, producing transfalcine herniation. The complete effacement of the basilar cisterns and compression of the brain stem are hallmarks of uncal and transtentorial herniation. There is trapping of the left lateral ventricle, resulting in its enlargement. Teaching points. With increased intracranial pressure resulting from a mass. Case 28 Gliomatosis cerebri. Findings. There are multifocal, ill-defined areas of signal abnormality, hyperintense on FLAIR images and iso-intense on T1 weighted images. They involve the cortex, deep gray nuclei, and white matter of both hemispheres, arrows. There is mild mass effect with sulcal effacement. There is no enhancement or restricted diffusion. Differential diagnosis. Acute disseminated encephalomyelitis or other demyelinating, dysmyelinating disorder, viral encephalitis, vasculitis, lymphoma, rare, non-announcing form, progressive multifocal leukoencephalopathy. Case 29 Hypoxic ischemic encephalopathy, HE. Findings. There is hyperintense signal on FLAIR and DWI images in bilateral hippocampi, arrows, basal ganglia, asterisks, and the cerebral cortex diffusely. ADC maps confirm the presence of restricted diffusion at these sites. There is mild cortical swelling and sulcal effacement, consistent with cerebral edema. Differential diagnosis. Creutzfeldt-Jakob disease, CJD, mitochondrial encephalopathy, toxic injury. Teaching points. Case 30 Developmental venous anomaly. Findings. The post-contrast T1 weighted images show an intracerebral complex of enhancing curvilinear vascular structures in the right temporal lobe. They coalesce to form a large vein that passes through the cerebral parenchyma to drain superficially. Differential diagnosis. Developmental venous anomaly, arteriovenous malformation, AVM. Teaching points.